Today, we will be discussing dementia. We will learn about the different types of dementia, the causes, signs and symptoms, occupational performance deficits, and some commonly used occupational therapy assessments used to evaluate the cognitive and functional levels of patients with dementia. Let's get started. What is dementia? Dementia is an umbrella term for a group of neurological disorders that gradually become worse over time. What parts of the brain are most affected by dementia? The hippocampus, which is responsible for memory formation and retrieval. The cerebral cortex, which affects memory, decision-making and social skills. The cerebellum, responsible for balance and coordination. The lobes of the brain are also affected by this condition. This includes the frontal lobe, responsible for thinking, memory, behaviors and movement. The parietal lobe, responsible for the language and touch. And the temporal lobe, which affects the hearing, learning and feelings. Dementia affects many more areas of the brain, but these mentioned are the most impacted by this condition. There are 4 main types of dementia: Alzheimer's disease, vascular dementia, frontotemporal dementia, and Lewy body dementia. We will now discuss each type in the following slides. Alzheimer's disease is the most common type of dementia. It is characterized by an abnormal buildup of proteins that form amyloid plaques and neurofibrillary tangles in the brain. The symptoms of dementia initially present as mild, but eventually progress to moderate and severe. Vascular dementia occurs as a result to a disruption in blood flow to the brain, such as a blood clot or a stroke. Lewy body dementia is characterized by abnormal buildup of Lewy body proteins in the brain, specifically in nerve cells. It is often associated with Parkinson's disease. The last type, frontotemporal dementia, is caused by abnormal protein buildup primarily in the frontal and temporal lobe. What are the main signs and symptoms of dementia? Memory loss, confusion, disorientation, poor judgment and decision-making skills, difficulty with language and communication, and changes in mood, behavior, and personality. What are the causes of dementia? The most common cause is the presence of neurodegenerative diseases. Vascular events, traumatic brain injuries, infections and chronic substance use are also among the causes of dementia. Who is most affected? This condition typically affects adults 65 years and older. More than 55 million people worldwide are living with dementia. Women are commonly more affected than men. Because of the impairments in executive functioning, memory, and balance and coordination caused by dementia, individuals may face challenges in all the basic ADLs. For example, eating can be difficult as they may forget how to use utensils and recognize food. Dysphagia is common because of weakened swallowing muscles or sensory perceptual changes. This could lead to choking and can be extremely dangerous for older adults. Incontinence is also common and can affect toileting, since they might forget to use the bathroom routinely or might not feel the urge to go. Poor safety awareness might also lead to slips or falls during functional mobility and transfers, and can be detrimental to the health of the individual. When working with patients with dementia, there are some safety precautions that should be followed. It is important to keep the environment free of clutter or hazards to prevent the risk of falls. People with dementia are also prone to wandering or eloping behaviors due to their disorientation, so it is important to ensure that doorways and windows are secured. We should also make sure to provide clear instructions to increase understanding. Their executive functioning may be severely impaired, so it is important to always be patient and kind to those living with this condition. Occupational therapists use a variety of cognitive and functional assessments to assess the impact of dementia on a patient's daily life, occupational performance, and cognitive abilities. Some commonly used assessments to evaluate the cognitive levels of patients with dementia include the Montreal Cognitive Assessment, also known as MoCA, Mini Mental State Examination, or MMSE, the Allen Cognitive Level Screen, ACLS, and the St. Louis University Mental Status, or SLUMS for short. The Functional Independence Measure, or the FIM, the Barthel Modified Index, and the Performance Assessment of Self-Care Skills, or PASS, are assessments used to evaluate the functional levels of patients with dementia. These are only some examples of the many assessments that can be used. By utilizing these tools, Occupational therapists are able to determine the patient's strengths and needs and create an intervention plan to help them maintain quality of life.